Hi, my name is Arnold Saperstein. I am an internist and endocrinologist and the Chief Medical Officer of Cecelia Health in New York City. I'm going to present this presentation today of synchronous video engagements instrumental in successful diabetes medication self-management. So it's well known that one of the main issues challenging an individual's chronic disease management and especially diabetes is medication adherence. And clearly, when individuals are prescribed medication, about 30% of the time, they actually never start their medication. And it's well known that probably at the end of the year, individuals are probably not taking their medication. About 50% of the individuals are probably not taking their medications correctly or have dropped off completely in taking their appropriate medications. And what are the challenges? That individuals don't have the right level of support, and they haven't been taught all about their disease. They don't understand their medications. And we're going to present a case study whereby when we provided the appropriate clinical support, individuals had much better outcomes in their diabetes management. So this clinical case was referred to our Cecelia Health virtual clinic to both evaluate their diabetes and to have a team of a remote endocrinologist and a remote CDCES certified diabetes care and educational specialist via telemedicine provide support in helping them manage their diabetes. This patient was prescribed a continuous glucose monitor for ongoing assessment of their glucose values. So what we found out was when we were monitoring their CGM, they were taking their insulin, but it didn't seem to have any effect in their management and their glucose levels. So at one point, we did a video visit with our CDCES, and our CDCES learned that this patient was following their diet closely, was living a relatively healthy lifestyle, had a daily walking regimen, and found out that their endocrinologist kept increasing their insulin dose at every single visit, but there was no opportunities, no change in their glucose levels, and it wasn't being controlled. So the benefit of the video visit is we found out that when we asked the patient to demonstrate how they were using their insulin, we found out that they were taking off only the outer cap, but they were leaving the inner cap on, covering the needle, so they were effectively not getting any medication. Luckily, they were on with the CDCES, who not only explained the appropriate administration of the insulin, but also stopped the patient from taking their full dose, because they had been raised to incremental doses, but had not been taking it. So had they taken this very large dose, they would have bottomed out right away. So the CDCES started them on the appropriate low dose and slowly managed them over the next couple of months to bring them up to the dose that they actually needed. And if you look on the right side of the slide, it's really amazing. This patient started out being in range only 4% of the time, and after 3 months was 98% of the time had their time in range. So what do we learn from this? The case demonstrates that there are tremendous benefits of having support outside of the physician's office through a remote CDCES to actually, while the patient is home, to help observe what they're doing, to provide the education and support to the patient. And in physicians' offices that are very, very busy, there really is limited time for the physician to provide all of the necessary support that the patient needs. So a virtual home-based intervention model, as we've shown it to be, is clearly effective in improving medication adherence and clinical outcomes. And our takeaway message is that incorporating remote CDCES monitoring into care plans can positively impact medication adherence and clinical outcomes. Thank you.